Welcome to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. On the show this week, we cover several important topics that you're going to love hearing about. First, we talk about fair pay, how some pay is unfair, and how to make it fair. After that, we talk about the need for fair treatment of all immigrant families and what you can do to make that happen. Following that segment, we dive into the importance of mental health care, particularly in rural areas, and how you can lift that up with your friends, family, and community. And we close the show with the inside discussion about what's happening in Washington, D.C. right now with the budget. We're going to jump right in with our first guest. Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. We have a spectacular nation-lifting guest for you today that's going to give you the inside scoop and exclamation for what the heck is going on inside the U.S. Capitol in Washington, D.C. right now. We have Alyssa Schmier of Moms Rising. Welcome, Alyssa.
Hi, how are you?
I am both happy to be here with you and furious about what's happening inside our nation's capital right now. I'm happy you're here because you can explain what's happening and share how the voices of moms, dads, parents, and people are slowing down terrible policy. But, what is happening?
Yeah, terrible, awful, stressful, unnecessary. These are all words that are totally valid and describe what's going on in the Republican-led House of Representatives right now. So this has been a pretty marathon couple of days. They are actively, very quickly, oftentimes in the dead of night, pushing forward their what Donald Trump calls the big beautiful bill. I call it the giant awful dumpster fire, which is a budget and tax cut bill. And I'm going to focus on the budget piece first because that explains, the awfulness of all of this. So this is a massively large bill that is attempting to make historical changes to the healthcare, nutrition, education, housing, and other policies that our families and communities have used for decades. Proven programs that save families, fund money into our economy, and help businesses. So I'll go through some of the highlights or lowlights, so to speak, of what's going on right now. So the House Republicans, the bill that they are proposing that they are trying to vote on in the next couple of days would make major cuts to Medicaid and increase work requirements in order to access health care. What they're looking at between Medicaid cuts and changes to the ACA premium tax credits that are going to expire, this will result in 13.7 million people going uninsured, losing their health insurance. And that includes 40 million children. So that's bad enough as it is. They're proposing cutting more than 300 billion from SNAP food stamps. This is the largest cut in the history of this program. This is going to lead to around 3 million people losing SNAP entirely. And then an additional couple million of people are going to see a massive reduction in their SNAP dollars each month. And let's be clear, they get about $6.15 per meal per day in order to feed themselves. So reducing it even further at a time when we're seeing record high grocery prices makes absolutely zero sense. And then they're also doing two major things to food stamps that people should be aware of. One is they're proposing additional work requirements. So right now, the vast majority of SNAP and Medicaid recipients do work. But right now, the exemption is for people with children under the age of 18. They're doing a very large shift from that, and they're saying that work requirements will be extended to parents with children over the age of 7. I believe that the chairman of the Ag Committee actually said that if your child goes to school, the parent can go to work, which, as a parent of a 3-year-old, I don't expect my situation to change that vastly when he's 7 in terms of my child's care needs and before and after school care. What do you do during the summer? What happens when they're sick? So that entire situation is disgusting and will lead to children going hungry. And then the other major change is they're doing a shift to the states and making states more responsible for paying SNAP dollars. Right now, it's mainly the federal government that handles that. And that cost shift, while it seems kind of wonky, is actually a really big deal because, as many of you probably know, states are having their own budget crisis right now, and they just simply can't afford to pick up the bill that House Republicans are trying to leave on the table. Um, a couple other key things that people should know about this bill is they have $5 billion. Sorry about my dog. $5 billion for private school vouchers in the bill. They're trying to sneak that in. And they don't do a lot of things that we were thinking that they could do. Like, this is a tremendous opportunity to expand the child tax credit, to invest in childcare, to invest in paid family leave. They don't do any of that. But they do massively cut our education, healthcare, and nutrition programs. And the reason they're doing that is to give trillions of dollars in tax cuts to billionaires and mega corporations. And it's very clear of that is the goal. That is what they're trying to do. It was all over the statements that they were making. And basically, they're going to give millionaires a $68,000 tax cut, and the top 0.1%, so the wealthiest people in this country, are going to get a $300,000 tax cut, while raising taxes or doing nothing for 33 million working class households.
That's ridiculous. It's outrageous. And I have to say to our listeners, if you were listening closely to this list of doom and thinking the math isn't mathing, you are right. Right now, we have, and I'll just give a little summary about what Alyssa just shared. We have massive cuts to programs that allow families to thrive, that allow parents to go to work, that allow our economy to be strong, happening by Republican leaders, all to give tax breaks to people who are already very wealthy. And we know from history that there is no such thing as trickle-down effect of giving tax breaks to people who are already wealthy. Instead, what it does is suction or vacuum that money right out of our economy in a very bad way. So what is happening? And I want to share a little bit more about the economics and the math of this non-mathing situation. We talked about SNAP being cut by Republicans and Donald Trump. Well, when SNAP is cut by Republicans and Donald Trump, we actually hurt our economy, because when we have SNAP, which is food stamps, people most immediately use those funds to buy the food in the grocery store, which supports the grocery store, which supports the truck driver that brought the food to the grocery store, which supports the farmer that grew the food in the first place, and the list goes on and on. In other words, SNAP boosts our economy. And Republican analysis show that for every $1 in SNAP, because of that, we get $1.79 back later. Similarly, we have math that actually shows the return on investment for everything that Republicans and Donald Trump are trying to cut. Childcare, for every $1 invested, we get back at least $8 later. Healthcare, we not only get back money later, because if you treat an illness early, you save money in the long run. We also save lives. Hello, everybody gets sick. Everybody needs a chance to get better. So these cuts that Republicans and Donald Trump are making hurt the economy, all to give more tax breaks to the ultra wealthy. And I've had questions. People, I know you have questions. We hear questions like, hey, don't we need to spend less as America to have these programs? Well, the way to have the fair taxation system work is to have wealthy people and corporations pay their fair share. And many wealthy people are paying per percentage of their income much less than people who are lower and moderate income people are paying in their taxes. So my hair is on fire. I'm outraged. And Alyssa, one of the things that you and I have talked about a lot is that in this moment, when the math isn't mathing, when the policy isn't policying, when our Republican leaders and Donald Trump are not working for us, our voices are more powerful, more essential, and having an impact more than many of us would even imagine. So, can you give us a little bit of a background on how do you see the calls, the letters, the petitions, the meetings, the rallies making a difference in the direction of policy right now?
Yeah, I think, absent of the ability to actually like write the bills ourselves, our voices and that type of grassroots natural pressure, I think is incredibly important. And it's working because let's be clear, the Republicans have the White House and both chambers of Congress. This bill should have been passed in February. It is now May, and they are still not even sure what's going to happen and what the path forward is. And a lot of that is because we've had the ability to completely slow down the process. There is now a growing chorus of Republicans who are saying, both behind closed doors and out in the public, that they are very nervous about the size of the Medicaid cuts that are happening, and that they recognize that that will hurt their local communities, that that will decimate healthcare in rural communities, especially, that they recognize the amount of people that that program helps. So we are seeing that that is helping to slow down the process. We are starting to see that states, even Republican states, are saying, the governors are saying, there is no way that we can cover the cost for SNAP and other pieces that the federal government is going to shift to the states. And so I think that this using our voice is actually, we're starting to see it work. And also, it's not a given that this bill is going to pass the House, no matter how quickly Speaker Johnson's trying to jam that thing through and try and get that vote as soon as possible. And even if it does, it's almost dead on arrival in the Senate. There was a very conservative Republican senator who said the other day that this House bill is basically the Titanic and the Senate is the iceberg that it's about to run into. So they are already saying that they're going to go back to the drawing board and redraft this bill. Now, I don't think that the Republican senators are actually going to do a super great job at that either. So we're going to have to continue to apply that pressure. The goal is that this bill doesn't see the light of day, never makes it to Donald Trump's office in the first place in any way, shape, or form. But we can't get tired. We need to keep speaking up because it's actually working. I mean, it's very obvious that it's working.
And I want to tell listeners, you heard it directly from somebody who is inside the Beltway, talking with members of Congress, talking with staff inside the Beltway every day, that your voice, your power, your calls, your letters to the editor, your meetings, your rallies, your stories are making a huge, huge, huge difference. And we also know this is a marathon and not a sprint. And we also know there's a lot on the line. There's our family's health on the line. There's our economy on the line. There's our own economic security on the line. And all of us in our communities and our democracy is on the line. So please, please, please keep the calls going into Congress. Say hands off Medicaid, hands off childcare, hands off SNAP. Make sure that your budget and your tax system works for us. Don't give a big giveaway to people who are already wealthy. They don't need more money. We need to boost the economy, not people like Elon Musk. Thank you so much for being on, Alyssa. Do you have a last 30-second thought on an action for people to take?
Yeah, just call your House representative today. Do it right now and make your voice heard. Tell them to vote no on the Republican budget, and they will know exactly what that means.
Thank you. Thanks for all you do. Thanks for being on. Thanks for being a superhero for families. Thank you. We're going to take a quick break, but stick around. We'll be right back with our next guest talking about the fair treatment of all immigrant families and why it matters more than ever right now. We'll be back in a quick flash. Welcome to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. We have a very special topic to cover with you all today. What's happening in rural communities? Too often, the contributions, the needs of people living in rural communities in America are overlooked and aren't discussed. But we are going to resolve that today. Coming on with us, we have Chuck Strand, who's Executive Director of Rural Minds. Welcome, Chuck.
Hi, Kristen. Nice to be here. Thanks for the
I'm
opportunity.
so glad you're here. So glad you're here. Can you share a little bit about the background of Rural Minds overall?
Yes, well, Real Minds is the only national 501c3 nonprofit that's focused on advocating for rural mental health equity, promoting mental wellness, and providing educational content to confront rural mental health challenges and the stigma that surrounds mental illness. So there's 46 million people living in rural America, and those folks are living in farming, ranching, agricultural communities, small town, isolated areas across rural America. So that's really our goal. We want to really address the underserved needs specific to mental health for rural America.
I'm so glad you're here because this month is Maternal Mental Health Month. And your organization, again called Rural Minds, exists in large part to serve the quote, informed voice for mental health in rural America. What
Exactly.
are the special challenges that new moms, particularly in rural areas, face? And how are your communities being served regarding to perinatal mental health? What's happening?
Well, I think the challenges surrounding perinatal mental health really fall under the broader scope of rural mental health challenges. And there truly is a mental health emergency in rural America. Compared to urban areas, people who live in rural America have higher rates of depression and suicide, but they're less likely to access mental health care services. And according to the CDC, the Centers for Disease Control and Prevention, suicide rates among people living in rural areas are 64 to 68% higher compared to people living in large urban areas. And I can go on too if you're interested in hearing more about the challenges, but I'll take a breath and see if you want to respond to any of that information.
I would love to hear more about the challenges. When I had my first baby, I was living in a rural area and I was like, it takes 30 minutes to drive to the grocery store. There is no local group for me to hang out with of other new moms. It was the most isolating experience I've ever experienced in my whole life. And then we soon moved in closer to a center where I could actually walk to the grocery store. But it was hard. So I'd love to hear more about different aspects of how rural areas are both beautiful and glorious and offer special opportunities for, often being in nature and having like lots of things that you can't have in the city, but also what are the special challenges?
Yeah, well, that's true. There's pluses and minuses for sure. And I'm sorry to hear about your challenges. And unfortunately, that's not uncommon. And in addition to the greater distance away from services and healthcare, there's greater stigma or shame that surrounds mental illness in rural communities. And a barrier to healthcare in rural areas, it really also includes financial constraints. Mental health services can be expensive, and rural residents may have limited access to affordable insurance or financial assistance. And specifically the access to healthcare, especially mental health care, that's a real challenge because only 35% of rural counties have a psychiatrist and just 19% have a psychiatric nurse practitioner. And then beyond that, even for primary care physicians, the folks are looking at 20% fewer PCPs in rural communities rather than when you compare it to urban areas. And to your point earlier, it's you're further away from getting a fewer number of PCPs get challenges in getting an appointment. But then when you're actually going to your appointment, you've got to travel further. And some people don't have access to cars. You've got to arrange transportation. And just one more point that's specific to women living in a rural area. Less than 50% of them have access to a perinatal service within 30 miles of their homes. And with about 1 in 8 women experiencing postpartum depression, this distance could be detrimental in addition to all the other challenges that women who are expecting or having just had a baby are confronting.
I mean, and this challenge that we're talking about are there before we had Trump and the Republican-led budget moving through Congress, which is proposing or has been proposing $880 billion with a B and cuts to Medicaid. And Medicaid is actually what keeps the doors of many rural hospitals opened, is what funds many rural health programs, including rural mental health care programs. And it is just appalling to me, knowing people who live in rural areas, having family in rural areas, to even have Republican leadership in Congress and Donald Trump proposing or contemplating pulling out the resources that are there now, because the resources now are not enough. We need to expand access to healthcare in rural areas, not roll it back. So that's just my little editorial moment, my hair on fire moment about expanding rural health access, not rolling it back. And I'm just appalled again that the Republicans and Donald Trump are trying to roll it back. And when they roll back programs like Medicaid, it actually increasingly adversely affects rural areas, because many states, which are majority rural area states, have, the majority of their state budget, more than 30% of their state budget, actually funded by programs like Medicaid. So again, if you live in a rural area and you're looking at what's happening with the national budget, call your member of Congress and say, hey, no cuts to Medicaid, hands off also SNAP, hands off childcare, because those programs actually increasingly help the families and the economy of rural areas than almost any other area. I want to dive back into a question about maternal mental health in rural areas related to the substance use epidemic. Do we see different situations in rural areas happening related to maternal mental health and substance use?
Well, just from a wider perspective, a study that I believe was done by the Indiana University indicates that stigma around substance use disorder is greater among people living in rural counties compared to urban counties. But when we talk about substance use disorder, it's important to acknowledge that alcohol is a drug. And I've got a couple stats to consider if you'd like me to share those.
I love stats.
Okay. Studies suggest that rural areas are often experiencing higher rates of alcohol-related deaths and harm compared to urban areas. The opioid overdose rate is 45% higher per capita in rural communities than in urban areas. And only 14% of U.S. behavioral health outpatient treatment facilities are located in rural communities, with less than half of them specializing in treatment of substance use disorder.
Those are really painful stats.
Yes.
Thank you for sharing them.
Yeah.
Go ahead.
I would say, in addition to that, most patients diagnosed with substance use disorder experience guilt, shame, or embarrassment. And this can be compounded for women who are pregnant or new mothers. These feelings that can either have a positive or a negative impact on whether or not a woman initiates treatment for substance use disorder. But because the circumstances, they can be motivational for some women, but others may be reluctant to initiate treatment just due to the stigma and maybe a concern that diagnosing a substance use disorder may result in losing custody of her baby or other children. And there's other, potential barriers to treatment. The barriers to the treatment include the housing and the food insecurity, transportation or lack thereof, and just demands of childcare.
This is a really heavy data, and I'm so thankful for you for sharing it. And given that we have this threat of Medicaid cuts, which actually fund a lot of the programs and even the doors of rural hospitals staying open, how would that threat impact rural mental health resources, particularly for moms in rural communities? What is on the line right now?
Yeah, well, just to take a step back, the mission that you kind of mentioned, part of it as far as Rural Minds, we want to serve as the informed voice for mental health in rural America. And, we do take an apolitical stance on what's happening, but it's part of we feel it's part of our duty, specific to being the voice of mental health, informed voice, because a lot of things are happening that have an impact on how stressed out people are, how much anxiety people feel. So we feel like it's important for us to share the facts, and people can do with that information what they choose to do. But we also do provide access to people reaching out to their member of Congress. But to your point earlier, the reduction of federal funding for Medicaid it'd have a disproportionately negative impact on providing health care in rural communities, since a greater percentage of people living in rural America rely on Medicaid benefits. And in rural areas, incomes are lower. Fewer people have employer-sponsored insurance compared to other parts of the country. So any cutting of Medicare would definitely be detrimental. And I've got some more numbers if you're interested in more
I
details.
always love numbers. The numbers are awesome.
Right.
I have to tell you a little secret.
Yeah.
When I was out in the rural area that I was living in when I had my son, and had this infant, he actually had a significant health crisis. He was born with a primary immune deficiency, and so he was really sick. And so I was out in a rural area with a infant who was sick, and I was feeling very alone. So do you know what saved me? Numbers. I did what anybody does when they are having an emergency in a rural area. I called the U.S. Census.
Okay.
I called the U.S. Census and I said, how many parents are there out there who have been pushed out of the labor force? In this instance, because I didn't have any paid family medical leave when my baby arrived, and my baby arrived with a serious health crisis, I, lost my job, right? And so I was like, how many people are there out there who are out of work, out of the paid labor force, and raising kids? And the U.S. Census told me, I do not know. We do not know. We only know how many people there are in the shadow of a married spouse. And we know why that data is not necessarily helpful, because, a significant amount of people are unmarried. And so what they did tell me is that families with a stay-at-home parent, were 7 times more likely to live in poverty than those with 2 full-time working parents, which makes sense.
Yep.
Need moms in the labor force to make ends meet. So that moment of numbers made me, as a new parent, feel so much less alone, though, because I learned that there are millions and millions and millions of people like me out there. And so I love your numbers. What were the numbers you were about to share?
Well, back to the Medicaid, any cuttings will negatively impact healthcare overall, but the services treating mental health and substance use disorder are really a standout. And approximately 18 million women of reproductive age live in rural areas, where they are more likely to experience maternal health risks than the women living in other areas. And Medicaid plays an important role in providing maternal health care and pays for a greater share of births in rural areas. So cuts to Medicaid would shift additional costs to rural patients who already may be struggling with financial instability. Without Medicaid, higher out-of-pocket expenses will force many people to delay or just forget about necessary treatments. So this would ultimately worsen health outcomes for folks in rural communities.
So listeners and viewers, one of the things that numbers do is show that we're not alone. Show that if you are feeling isolated, you are not the only one out there experiencing that situation. And in this area, when we're talking about access to mental health support, access to healthcare, it's so important for everybody to know that you're not alone and that you can get help. We only have 2 minutes left, but Chuck, can you share with us how people can get help and get to your website and take action? And, what are our next steps?
Yeah. Well, all the barriers to rural mental health that we're discussing have been part of what's led to establishing Rural Minds and the work that we're doing here. And we're all about providing information that's free to confront mental health challenges in rural America, along with the greater stigma that surrounds mental illness. So the Rural Minds website, which can be found at ruralminds.org, that's RURALMINDS. We've got a compilation of free information about postpartum depression, in addition to other mental health challenges. And at the top of the list for crisis resources and support is 988, the Suicide and Crisis Lifeline. So as you may know, 988 provides free confidential connection with trained mental health counselors. We also have a mental health conditions fact sheet on postpartum depression on our website, and a webpage with mental health resources by topic, which includes several listings specific to postpartum depression.
Thank you so much for sharing that. Thank you so much for being on. Thank you for all you do. Thank you, thank you, thank you.
Well, thank you for the opportunity. It's been great. Appreciate it.
Thank you. Don't go away. We're going to take a quick break, but right up next, we're covering rural mental health, why we need to improve access to healthcare and mental health care in rural areas. We'll be back in a quick second. Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. We have a spectacular guest joining us today. We have Taylor Austin with Moms Rising. Welcome, Taylor.
Hi, Kristen. Thanks for having me.
I'm so glad you're on. Recently, we marked the most horrifying day. Well, maybe not the most horrifying day, but it's certainly a depressing day, which was Moms Equal Pay Day. And that is the day in 2025 that moms have to work in order to earn what dads earned in 2024 alone. And yes, people who are looking at the calendar, it is May, the 5th month into 2025. Taylor, can you share a little bit about the wage gaps and what's happening and sort of what they are? Because there's a bunch of different wage gaps, not just one.
Sure. So since we're talking about mothers specifically, and Moms Equal Pay Day falls in May, that number is 74 cents for every dollar paid to dads that are working. And that's our full-time year-round worker number. The number gets much worse when we start to include folks who are working part-time or people who work seasonally. And so that number drops to 62 cents on the dollar for all working moms. And that puts them somewhere in August, if we're talking about the time frame that it takes them to make the same amount of money that dads made in 2024.
It's awful.
Mhm. It is. It's horrendous. And not only that, but we're also, if we take a deeper dive into some racial and ethnic breakouts for that, Latina moms, Native American moms, and Black moms are all earning less than 50 cents on the dollar to white dads, with Latina moms earning just 43 cents, Native American moms making 48 cents, and Black moms making 49 cents. White mothers make what we are calling our average, which is 62% on the dollar, and Asian American, Native Hawaiian, and Pacific Islander moms are making about 73 cents on the dollar. However, that number is even misleading because that group, Asian American, Native Hawaiian, and Pacific Islander folks, there are so many different communities within there that make less than 50 cents on the dollar. So that's not even a full representation or accurate depiction of how steep the wage gap is for women of color.
This is a terrible, awful, very bad situation. It's not just a very bad situation for the 86% of women who do become moms by the time they're 44 years old, but also for America. So when we look at how our economy runs, what fuels our economy, right now, 72% of our GDP is actually consumer spending. And women and moms make over 80% of those consumer spending decisions. So we know that when we don't have money to spend, when we don't have fair pay, then we all lose out because we can't fuel the economy by buying those shoes when our kids' feet grow and need a new size shoe, or buying anything that we need in our homes, or putting food on the table. I mean, really, it's a big problem. And you can see the big problem in the inverse. And that is that places like the Institute for Women's Policy Research and more have found that if we did have pay parity, we would increase our nation's entire GDP by 3 to 5%. We would lift the whole economy. So when people talk about the mom wage gap, sometimes they're like, that's just a problem for moms. But no, it's a problem for everyone. What are your thoughts on that?
I think that's absolutely spot on, Kristen. Moms are, especially moms of color, are 3 times more likely to be the breadwinners in their homes. And they're also the ones making decisions on consumerism in their home. And so if we don't have that money to spend, then we don't have that money to fuel the economy. We're also lacking money for retirement. And so this is a whole much larger issue than just a single paycheck, one family, one community. This is an economic issue that spans the country. And I think mothers deserve better. We deserve more.
We so deserve more. You mentioned retirement and the impact on retirement. Can you share some of those numbers? Because I think our listeners and our audience would be appalled at how these wage gaps add up over time.
Sure. So it's women who are 65 and older are usually losing about $5,000 a year in their retirement when the wage gap is considered. And so that's $5,000 that they don't have to put away in their retirement for their household bills, for any incidentals that come up when they are in retirement on a fixed income. And so that's truly detrimental to families. It's also detrimental to our economy.
Yeah, for sure. And one of the things, I have so many things to talk about this, because there are so many things. So I have two things that I want to talk about at the same time, but we'll take them one at a time. One of the things is sometimes I hear people say, it's mom's fault that they're getting paid less for the same work. Well, we are here to tell you it is not. So that's the first thing we want to talk about. The second thing we want to talk about, listeners and audience, is there are solutions. So we'll get to that, because this is not an unsolvable problem. So first, let's go back to the whose fault is it issue, because I tell you, every week somebody says, well, isn't it just your own fault? No, it is not. So we have rooms full of studies that show that this wage gap is based on actual discrimination. And here's one of them. Cornell University and Stanford University did a study of 2 pieces of paper. Note, there's not a person involved who could have been working harder. There's not a person involved who could have been, quote, leaning in or not leaning in. There's not a person involved who could have done better, in some way, shape, or form. We're talking about paper. And that's why I love paper takes the personality out of the conversation. So there's 2 pieces of paper they have equal resumes and equal job experiences on both pieces of paper, with one difference. The one difference is on one resume, it says that they're a mom. On the other resume, it says nothing about motherhood. And guess what? Moms were hired 100% less of the time than non-moms, and were offered $11,000 lower starting salaries for highly paid jobs. So people are like, maybe that just happens to parents. Nope. Same study was done with dads and non-dads. Dads were offered $6,000 more. So what we see happening is moms getting a wage hit, dads getting a wage bump, and then with moms getting a wage hit, as you just mentioned, you pull into that also structural racism and discrimination. And we see this delineation where moms of color are experiencing compounded wage hits that are based on discrimination. So do you get that question often too about, is this really happening? Is this your fault? What's happening? What should we also share about why this is a real problem?
Kristen, you're absolutely right. Racism and sexism are 2 of our largest factors. The motherhood penalty is also a large factor, but we also should talk about disproportionate care responsibilities, right? So mothers spend considerably more time on caregiving activities than fathers, and that's unpaid work. And that unequal distribution of unpaid work limits the amount of hours and opportunities that they have in the traditional workforce. And so a lot of moms end up being pigeonholed into part-time work or no work at all, because they have to take on these other caregiving responsibilities that are unpaid. And that's I would say, a large contributor also to the wage gap from others.
100%. And that also explains how we get to some of these solutions. It's like a good bridging conversation. And I like to say caregiving is work. Paid caregiving is work. Unpaid caregiving is work. And we have so devalued and made invisible the unpaid caregiving work that devaluation follows people who are caregivers all the way over into the paid labor force. So what are solutions? Well, study after study shows that when we build a care infrastructure, that we can close the wage gap. So what is this care infrastructure? Well, we can help close the wage gap. The number of different policies need to happen at the same time. And that includes access to paid family medical leave, like every country except 6 already have in place. And we are one of those countries in those 6 that doesn't have it. Access to affordable childcare, and childcare right now costs more than college in most states. And importantly, childcare workers, many of whom are moms, also are paid some of the lowest salaries in our country. Access to healthcare, and healthcare Republicans have put on the chopping block right now. It's ridiculous, but access to healthcare, access to earned sick days. Everybody gets sick. Everybody should have a chance to get better. And those policies, combined with policies like the Paycheck Fairness Act, are together how structures can be built to help lower that wage gap that study after study has shown is a way forward? Did I miss any policies that we need for solutions?
No, I think policy-wise, you're spot on. And just to reinforce the Paycheck Fairness Act, that was just reintroduced at the end of March into both the House and the Senate by Senator Patty Murray and also Representative Rosa DeLauro, who worked on this for many, many years. We are grateful for their championship of the Paycheck Fairness Act. And we really do need these policies, like you said, to happen all at the same time, right? To help us close the wage gap for moms.
Yeah. And some people say, you have too many issues. You have too many bills that need to happen at the same time. To that, I say, Congress covers thousands of bills every session. They can do R4 at the same time. This is possible. And it's not rocket science. Studies show that these policies boost our economy, our businesses, and our families, and our health. So this is, I think really important. What should people do right now? Do you have advice on activism?
Sure. I think number one, if you have been a victim of pay discrimination, of wage discrimination, if you have experienced the motherhood penalty, I think talking about it, sharing your story, helping other moms, other parents, and other caregivers know that they're not alone in their experiences, I think that is very important. And Moms Rising is always here to hear your story, to help you share your story with those who need to hear it most, which are legislators. They are much more moved by the personal stories of their constituents than they are by the numbers, the data. They want to hear about what is happening to their constituents. And so I think sharing your story is extremely vital. And then I think other ways to get involved, other ways to help push this work forward is to sign on to petitions, sign on letters with your local and federal advocacy organizations that are doing this work, like Moms Rising. And we will link to a petition that you can sign to help moms achieve equal pay by calling on Congress to do just what we said, which is support and sponsor and push through some of these bills.
Yeah, absolutely. And they need to do it yesterday. And I'm mad. I have to share my madness right now. I'm mad because those policies that we just named to help close the wage gap are the very same policies that Republican leadership and Donald Trump are suggesting get massive cuts right now in our nation's capital just to give billionaires more tax breaks. I'm so mad. And some people say, well, does it cost too much money to do? No, it costs too much money not to do. And in fact, it would easily be paid for, all of these programs, by a fair tax system where bazillionaires and corporations pay the fair amount of their taxes, similar to what the rest of us are already paying. That would actually cover these programs entirely. So hello, I want to add in, when you call into your member of Congress and say, push forward the Paycheck Fairness Act, also say, push back the Republican budget that undermines families and our economy. I mean, I'm so mad. Are you mad about that?
Absolutely. And we really do need Congress and this administration to prioritize families over billionaires, over the wealthy, because the families of this country are the bread and butter of this country.
And the heart and the soul and the thank you for being on so much. Thank you, Taylor, for all you do. Thank you for joining us today.
Yeah, of course. No problem. Thank you so much for having me.
Thank you. Don't go away. Next up, we're covering what's happening inside the U.S. Capitol in Washington, D.C., and why it matters to you. We'll be back in just a quick moment. Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. I'm so glad you're joining us today. We have another special guest for you, Wendy Cervantes, who is with the Center for Law and Social Policy, also known as CLASP. Welcome, Wendy.
Hi, happy to be here.
I'm so glad you're here, but I'm sad that you're here about a topic that is frustrating, devastating, heartbreaking, all of the things. Right now, we have Donald Trump administration doing mass human rights abuses, as he's saying that it's immigration enforcement, but really what we're seeing is mass human rights abuses. What's happening right now, in particular in America, with families who have mixed statuses and children?
Well, what we're seeing right now is like just a broad overreach of the enforcement actions in a way that we've never seen before. And this is, we're basically talking about family separation in our own backyards, where families who have resided in this country for decades even, and who have children who are US born citizens growing up, attending our schools here, are now facing detention and deportation virtually overnight without any opportunity for parents to really truly make informed decisions about their children's care. And so we have, you've probably seen the headlines. We've heard about these recent stories of US citizen kids being quickly deported along with their parents, and a lot of questions about whether or not parents are really able to make decisions about whether they take their kids with them or leave them here. And that's really, really concerning. And, we've seen a violation of due process across the board for many immigrants, but this is touching US citizens, including some of the most vulnerable, which is our US citizen children.
You mentioned a violation of due process that has been in the news, in the headlines, and unfortunately, ICE and the Trump administration are violating due process all over the place. Can you share with our listeners what is due process and where does it come from?
I mean, basically, the idea of due process is that if you have an opportunity to go before a judge to determine the outcome of whatever it is you're being, charged with. And in the case of immigration, and in the cases of an immigration policy, it's a little bit more complicated because but really important, because being able to go before an immigration judge can determine whether or not you're able to remain in the country, enter the country, or even what happens to your children. And it allows a judge to be able to consider hardship to those to family members, and in particular if you have US citizen family members. And what we're seeing right now, and there's like a process called expedited removal, which basically speeds up that process and undermines a person's ability to have due process and to have the opportunity to go before a judge and to have a decision made about whether or not they can stay in the country. But for US citizens, there's a whole other level. I mean, you would imagine that if you are a US citizen, you should be entitled, even more so, there should be no question about your access to due process. And yet we're seeing this very opportunity like not be given to even US citizen children in these cases. And what the Trump administration is claiming is that they are providing parents the opportunity to make decisions. There is actually a policy that exists that has been in place since the Obama administration that Tom Homan himself put into place and hasn't been an advocate for, which is called, was formerly called the Parental Interest Directive. It's had some different names over the years, but it's basically been in place to specifically ensure that ICE allows parents to make a decision, whether or not they're going to end up being removed, about their children's care throughout the removal process, and in particular before they're deported. And that can include bringing their children with them. But as you can imagine, all of us who've known what it is to move, even if you're moving from one state to another, you have to make sure you have a lot of things in order, especially when you're moving with your family, to have school records, medical records. We've seen children that are being deported who are undergoing cancer treatment. You want to be able to consult with your doctors, consult with your lawyers, figure out what is truly in the best interest of your children, get passports ready if if you're moving to another country. And all of that takes time. And we know for a fact that in some of these recent cases, parents were not afforded that opportunity, were not allowed to talk to their attorneys, even when their attorneys were present in the facility. And they certainly didn't have time from one day to the next to be able to make informed decisions or consult with their children's doctors.
A lot of people don't realize that there is international law related to amnesty as well as national law related to amnesty, and that many of the people who we are talking about in communities that we're talking about, even ICE's own analysis shows that if there was access to attorneys, then they would qualify for amnesty. But it's the lack of access to attorney, lack of access to being able to advocate that is putting a lot of people in really difficult situations. Can you share a little bit about that? Because it's complicated. We definitely have a complicated situation happening, but it's, you know, the amnesty situation is something that is invisible to many people.
Well, I mean, I think when we think of, if you're talking about amnesty in the immigration context, I think what we actually talk about more right now in the current context is something called prosecutorial discretion, which you know, where a judge can actually someone can grant, in some cases a judge, in some cases an immigration official, can grant some sort of relief or discretion to people who qualify for certain humanitarian reasons. And under previous administrations, the executive branch has you know, technically the executive branch currently still has the authority to implement prosecutorial discretion, meaning that they will not seek to deport someone. They can even go so far as to allow them to have some sort of temporary permission to remain in the country, and even have a work permit so that they can work and support their families while they're here, pending, you know, other opportunities to obtain immigration relief. The executive, you know, this administration is you know, really choosing not to exercise any types of prosecutorial discretion, not to truly prioritize who they take enforcement actions against, and actually widening the net of people that are vulnerable to deportation, to include families that have been here for a long time, who are have deep roots in this country, and who have children that are growing up here. And they're even looking to expand the number of people who could potentially be undocumented, essentially growing the undocumented population by stripping away temporary protected status and other forms of immigration relief that families currently have. And many of those people have US citizen children. And also going after the citizenship of babies. Today, the Supreme Court heard oral arguments in the Trump administration's attempt to repeal birthright citizenship. And that, you know, would essentially take away citizenship from our very youngest citizens, infants, and at a very critical time in their life. And actually, recent research has found that should this repeal of birthright citizenship move forward, there would be 225,000 children born every year without the ability to access birthright citizenship.
It's really, really a devastating situation. When we're talking about birthright citizenship, where did those rights come from in the foundation of our laws?
That actually dates back to a civil right, to the time of post-slavery, and has been a landmark. It was really critical to the foundation of civil rights in this country and to equity across the board. It dates back to what was known as the Dred Scott decision, which basically you know, pushed back against current thinking of the time right after slavery, that basically said that there used to be a policy in place that children born to slaves were not considered citizens. And so that decision really laid the foundation to be followed by decisions to follow that, to essentially confirm and to basically try to get it into the foundation of our Constitution. It's embedded in the 14th Amendment that children born on US soil are, you know, guaranteed access to citizenship, to really go beyond the prejudices of the day. And the Dred Scott decision confirmed that for children of African Americans, and another decision that came several years later also confirmed that for children of immigrants.
So basically, the Donald Trump administration is trying to overthrow the U.S. Constitution, rights that are protected in the U.S. Constitution, as they're attacking birthright citizenship. Did I hear you right?
Yes. It directly, you know, goes against the U.S. Constitution, and that's why the Supreme Court is now considering this challenge.
This is horrifying. Can you share a little bit about the long-term and short-term impact on families as we are in this experience of really, really, really devastating pushes from the Trump administration?
I'm sorry, can you say that one more time?
Can you share the impact, the short-term and the long-term impact on families in this moment?
Yeah, I mean, it's really, really mind-blowing. We have been, you know, I've been doing this work for a long time, over 2 decades. specifically looking at the impacts of immigration policies as they impact children in mixed status families. And what we know is that immigration enforcement, even just like the fear of potentially having your parent taken away, has really devastating impacts to both children's short-term outcomes, both their mental health, their ability to do well in school, their ability to access safety net programs, their economic security. And then it has, especially when a child is separated from a parent in their early years, that has like a really devastating long-term impacts to their development. And we're talking just about like the threat of deportation. When children are actually do lose a parent as a result of deportation, that's obviously something that they carry with them for the rest of their lives. And that also has a real impact on their ability to do well and their family to be able to thrive and get by, especially if the individual that is deported is a primary breadwinner, which is often the case. And then in cases, we have even seen in the past situations where parents have chosen to take their kids with them. A lot of mothers in particular who have babies or toddlers or young children choose to bring their child with them. And that can be a hard decision, especially if they're going back to a really dangerous country or some sort of situation that they were trying to flee from. But we even know in those circumstances, and like these cases that we're hearing about US citizen kids, going to another country right now, we know that there's real challenges. That's not an easy choice for parents to make, because those kids face real challenges in a country that they were not born in, that they may not speak the language themselves. And in many times, in certain countries, it's not as easy to enroll in school or to enroll in healthcare. If they're US citizen kids, those are children who can eventually come back here and might come back to us, back to this country with less access to education, less access to healthcare throughout their lives, and have more challenges that they need to deal with when they integrate back into US society. So I always tell people there really is no good outcome for children who are impacted by the detention or deportation of a parent.
We only have a couple minutes left, but I know everybody listening and watching wants to know, what can they do? What should people do who are listening and are very concerned?
Well, I mean, I think, there's one, you should certainly reach out to your member of Congress. There is currently a budget reconciliation package that's being considered right now that would essentially provide this administration a blank check and all the funding that they need to take this mass deportation agenda to the next level. And they're going to do that by essentially cutting Medicaid, SNAP, and other programs that families rely on all over the country, citizen and non-citizen alike. They're going to cut that take away food and health care from all children and families around the country in order to fund family separation and policies that undermine child well-being. Really, it's going to make what's already a crisis situation far worse. So people can certainly reach out to their members of Congress and, express that they, don't believe that that's the direction we should be moving, and that they don't want their tax dollars to go to a mass deportation machine that's going to separate families and hurt even US citizen children. And they certainly don't want to do that at the expense of programs that are so critical to families around the country. The other thing people can do is, there's a lot of local immigrant rights groups and groups that are working with immigrant families locally. Reach out, find out who they are, find out how you can help your friends and neighbors. And I think there's so much that needs to be done around narrative change and how we talk about immigration and immigrants in our communities. And so I think even just so I think it's important to get engaged as much as you can to express what you think to members of Congress, but also let your neighbors and your family know. If you know people who are really believing some of the myths and the hateful language that we're hearing from this administration and other anti-immigrant politicians, let's talk about what we really know about immigrants in our community, and remember our own immigrant roots, and talk more, and really share how immigrants contribute to this country and how important their children are to our country's future.
100%. Also, can they join the Children Thrive Action Network? We have about 15 seconds left, but if they can you share how?
Yes, just check the Children Thrive Action Network can be found at www.childrenthriveaction.org, and we're committed to protecting and supporting children and immigrant families. We're a network of providers and advocates, and we certainly welcome more people to join, and you can get updates about immigration policies in real time.
Thank you so much for being on. Thank you for updating us. Thank you for all you're doing. Thank you, Wendy.
Thank you, Kristen.
Thank you. Well, that's it for our show today. Thanks so much for tuning in as we tackle the top topics facing our nation in a way that requires the most boring disclaimer in the history of the actual planet Earth. Here goes. Views expressed on this show are those of the individual speakers and should not be attributed to Moms Rising, to this station, or to any news or social media service that may disseminate a recording of this show to the public or to any segment of the public. Boom! We'll catch you next week.